Hello, grade 11 students. In this video, we're going to talk about the karyotype. What is the karyotype? A karyotype is the arranged set of the chromosomes. So, arranged set of chromosomes from now on is called a karyotype. In a diploid homologous chromosomes, they are arranged as pairs according to this criteria. Number one, decreasing order of their size. Number two, position of the centromere. Number three, the banding pattern. So this is the gonosomes and the autosomes. So gonosomes, they are called the sex chromosomes. These chromosomes, they determine the sex of the individual, whether it's a male or female. These are X and Y. If it shows two X chromosome, for example, XX gonosomes, so it belongs to a female, to a girl. While if it shows X and a Y, we have an X and a Y, so it's XY, so it belongs to a male or a boy. So from now on, XX for a female, XY for a male. Autosomes, they are all the chromosomes except the sex chromosome. So we have 22 pairs of the autosomes numbered from 1 to 22, and we have one pair of the gonosome, which is the pair number 23. So we have 23 pairs. So what is the number of chromosomes? 23 pairs. 23 times 2 is going to be 46 different chromosomes, including the autosomes and the gonosomes. So this is the karyotype, where the chromosomes, they are arranged according to their decreasing order of size from the biggest one, pair number 1, pair 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, till the 22. These are called the autosomes, while the last pair is called the gonosomes. Here, in this case, it's XY, so it's for a male, while if it's XX, so it's for a female. Now let's move to the chromosomal formula. Chromosomal formula for the normal diploid. Normal diploid, always we have 2n, it's equal to 46. But it differs if it's for a male or female. So chromosomal formula should be written as this. 2n equal 46, comma, XX if it's for a female, while 2n equal 46, comma, XY if it's for a male. Here we are talking about the normal diploid. While for the normal haploid cell, haploid, we have one copy of each chromosome. So the 2n is going to be divided into 2. So 1n equal to 23, comma X, or 1 equal 23, comma Y. This one is going to be either from a sperm or from an ovum. Since the sperm, we have XY, ovum, XX. So here we have one copy. Either we have the X from the male or from the female. But this has two choices. But the one n equal 23, comma Y, it has only one chance. It comes only from the male. Chromosomal abnormalities. Chromosomal abnormalities, they are classified into two categories. Either chromosomal numerical abnormality or chromosomal structural abnormality. What's the meaning of chromosomal numerical abnormality? It's the abnormality at the level of the numbers, whereas chromosomal structural is the abnormality at the level of the structure of the chromosome. So chromosomal numerical, this the abnormality that affects the number of the chromosomes. Maybe there is an extra chromosome. We have an additional chromosome. So whenever we have an additional chromosome, there is no more 2n equal 46. We have additional. So it's going to be 2n plus 1. It's equal to 47. So we have an additional chromosome. This is the case of the trisomy or the tetrasomy or the Klein filter syndrome. Or it's going to be a missing chromosome. So we have a chromosome less. Like the case 2n is going to be minus 1 equal to not 46, equal to 45. So you have a missing chromosome, sure, comma, XX or XY, it depends according to the given, like the cases of monosomy or Turner syndrome that we're going to talk about them in the coming slide. So here, this is the karyotype of individual having trisomy 21. So we have 3 copies of the chromosome number 21. So it's a trisomy. All of them, they have 2 copies, but here we have 3 copies. So 2n plus 1, it's equal to what? To 47, comma, XX or XY. In this case, it's only XY. Why? In other cases, it may be XX. So depending on the case in the question. Here we have monosomy at the chromosome number 7. Why? Because we have only 1 copy of the chromosome number 7. We have only 1 copy of this chromosome. So it's a monosomy where 2n minus 1 equal to 45. And in this case, XY or the sex chromosome maybe is going to be XX if it's a female. Okay? Klein-Filter syndrome. From now on, you have to know that the Klein-Filter syndrome, it's 2n plus 1 equal to 47. So we have an additional chromosome and it's found in the sex chromosome. So this person is going to be a sterile person. It can't give birth. This person can't give birth to children. He has sterility problem since the abnormality affects the gonosomes. So whenever it affects the gonosome, the person is going to be the person has abnormality in the gonosomes and the sex chromosome, so it's going to be sterile, has sterility. This person is a male or female? Sure, it's a male. Why? Because we have the Y chromosome. Whenever we have Y, it's a female or a male. Sure, it's a male since we have the Y, and it has feminine characteristics. It has special characteristics for the female, but it's a male and the sex organs. This is the Turner syndrome, where we have abnormality also at the level of the gonosome, where we have only one X as sex chromosome. So it's a missing chromosome. So 2n minus 1 equal to 45, comma, XO. You have to write it by this way. So this is always and always like this. It's similar to the Klein-Filter syndrome. So Klinefelter and Turner syndrome, they have the same problems. They are in the gonosomes. Klinefelter, we have additional 2n plus 1 equal 47, comma, XXY, while the Turner syndrome, we have a missing chromosome. So it's 2n minus 1 equal 45, comma, XO, where O, it indicates the absence of another sex chromosome. And this female, it has a sterility problem. It has atrophy of the ovaries. The ovaries, they are very small in size, and this will lead to sterility. She can't give birth to children. Chromosomal structural. Before we talk about the chromosomal and numerical problems, while here we are going to talk about the structural abnormalities. They are the abnormalities that affect mainly the shape of one of the chromosomes or more than one. There is a translocation. Either we have translocation, meaning that a part of the chromosome, let's say 10, is going to be translated to the chromosome number 15. This is called translocation. Or we have a missing part of a segment, like this is the one in the cri du chat, the crying of the cat syndrome, crying cat syndrome. So they have a missing part of the chromosome. This can be detected by the karyotype. So here, abnormality in the chromosome number. So trisomy 21 is called familian Down syndrome. So the British physician who described the condition, this experiment showed affected individuals, they have 3 copies of the chromosome number 21. They showed the following symptoms. They have oblique eyes, short hands with unique palm crease, cardiac deformities, and they have mental retardation. Sexual maturity is usually attained. The frequency of occurrence is 1 in 700 births. Another type of trisomy 21 can result from the translocation, as shown in document C, this document, where affected individuals, they have the same symptoms as those of the trisomy. However, Their karyotype has, in addition to the pair chromosome number 21, a third chromosome attached or translocated to another chromosome. Here we have in chromosome number 14, it was translocated from 21 to 14. This piece is the chromosome number 21, so it's translocated. Why? Because in chromosome 14 we have a part that is greater than the other part. So here we have translocation, while in this one we have trisomy 21, where here we have something called translocation, and it has a name. It's called Robertsonian translocation. Document B is showing the variation of the frequency of the trisomy 21 as the function of the maternal age. So as you see, as the age of the mother increases from 35 till about 43, the frequency of the Down syndrome increases slightly from 1 to 3%, while as the age increases from 43 to 46, the percentage or the frequency of the Down syndrome, it increases sharply from 2 to about 9%. So as the age of the mother and the maternal age increases, the risk for having children with Down syndrome will increase. Compare the karyotypes of documents A and C. Both of them, they show 47 chromosomes, whereas karyotype of document C shows 46 chromosomes. The sex chromosomes in both karyotypes, they are XY. So both of them, they are males. Or the chromosomes, they are homologous and document A. And they exist in pair, except all of them, they have the same shape. 9 had the same shape, 10, 8, 14, 18, except for 21. What happens in the chromosome number 21? We have 3 separate copies. So we have an extra copy of chromosome number 21. Document C shows homologous autosomes. Autosome from chromosome number 1 till chromosome number 22, as we said before. These, all of them, they are homologous, except for chromosome pair number 14, where one of the copies, which is this one, is longer than this one. So here, the fragment that is added to chromosome 14 is chromosome number 21. So it was translocated and it was attached to this part. So this is the part of chromosome number 21. This is what do we call it? Robertsonian translocation, 21 to 14. It moved from chromosome pair number 21 to pair number 14. Two separate copies of chromosome number 21 are found, and the third, it's attached to chromosome 14. So that is the structural abnormality. It's called Robertsonian translocation. In this case, 21, 14, which is widely appeared. These individuals, they have Down syndrome, while Down syndrome hand in 2 and the normal hand here in 3. Sex chromosomes or gonosome abnormalities. Other abnormalities in chromosome number may affect the sex chromosomes, resulting in several syndromes. Turner syndrome affects women patients. They have short stature and they are sterile. Why? They have atrophy of the ovaries. The ovaries, they are very small in size, and secondary sexual characteristics do not develop. Whereas the Klein filter syndrome, XXY, it's affecting the males who are sterile due to the atrophy of the testes. They exhibit both male and female sexual characteristics. These individuals that are affected by Klein filter, they have abnormal development of the breast and often mental retardation. So this mental retardation, it's going to affect those who have Klein filter. Other abnormalities affect the sex chromosome like XYY and XXX and others. But here are the main abnormalities: Klein filter and the Turner syndrome. What can you conclude from document B? Already we explained document B. So as the maternal age increases from 35 to 44, the frequency of the Down syndrome, it increases slightly here from 0.5 to approximately 2.5 to 3%. Then as the maternal age increases to 46, from 44 to 46, the frequency of the Down syndrome increases sharply toward 8%. So this indicates that here I did interpret more than conclusion. So I did interpret and the conclusion. This indicates that frequency of the Down syndrome is directly proportional to the maternal age. So this affects the frequency of the Down syndrome. So the maternal age affects the frequency of the Down syndrome. Here we have two karyotypes of one having Turner syndrome, where it has X as sex chromosome. So you have a missing sex chromosome, while this one showing XXY. One is going to ask me, how can we determine the difference between X and Y chromosomes? Sometimes we don't give you the names X and Y. Sometimes I won't give you these. Okay? Sometimes I'm going to give you, for example, determine whether this is a male or female. Sure, we're not going to have two Ys. In your grade 11, sure, we're not going to have two Y. So the similar, they are X, and the smaller one is going to be Y. For example, if I have a large one and a small one of them is X and the other is going to be the Y. You have to pay attention. Write the chromosomal formula of the karyotype presented in documents E and document F. So document E, Turner syndrome. So 2n minus 1 equal to 45, comma, XO. While document F is for the Klein filter syndrome, 2n plus 1 equal to 47, comma, XX. Here, abnormality affecting the structure. Here, the Cray-Duchat disease, cat cry syndrome, causes severe mental retardation, larynx malformations, so that a baby emits sound like a cat's mewing. The karyotype of affected individuals shows an abnormality of one of the copies of chromosome number 5. So here we have a part of the chromosome that is deleted. So this is the cause of the Cray-Duchat, the cat cry syndrome. So here, what is the type of mutation? So for comparison of these two copies shown in document H, we notice that the abnormal chromosome is shorter than the normal one. So we have deletion of the chromosomes take place. So a fragment of the chromosome was deleted, and this was the case for the Cray-Duchat syndrome.